So let us start the practical number 11 to study the different pharmaceutical dosage form or drug preparation or pharmaceutical preparation. So what is the meaning of pharmaceutical dosage form? That we are going to first see what is the meaning of this. So as the name is clear cut indicating, dosage form are the form of drug which making a drug in administrable form to the patient is called dosage form. Means with the pure drug, chemical, agent, substance, we are making a formulation of the drug in such a way that it should be administrable to the patient is called dosage form, or you can say the administrable form of the drug in a patient is called dosage form. So this is very, very interesting. Now we have to go through different form of the dosage, and here we have not classified it because this is rather very cumbersome to make a line to differentiate different dosage form or different types of dosage form. Now we have to go the dosage form one by one. If you go through all the name of the different dosage form, you will find the various dosage form. You are aware about that, and I think you also are aware about the terminology that is used as a dosage form. See here aerosol. So aerosol is clear cut indicating is preparation that is concerned to air. So within the body of a patient, the air is concerned to the respiratory system. So therefore aerosol are the medicinal or drug formulation, usually in suspension form and in such a way the drug should be administered to respiratory tract is called aerosol, and also this also can be used on the skin. So aerosol are suspension of fine or solid or liquid particle of drug in gas. So this is very, very important. In gas, in aerosol, the drug should be in gas form so that it should be easily administered by respiratory passage. Like the example are bronchodilators, salbutamol and terbutaline. Both the drug are salbutamol as well as the terbutaline are having its effect on the lungs, and that is going to dilate the lungs, and therefore it is used for the therapy of asthma. So in case of acute asthma, the lungs has to relax so fastly it will feel the patient relief from the pain. So in this aerosol bronchodilator, salbutamol and terbutaline has to be administered in gas form, and because of the gas form the drug will reach very easily to the respiratory tract, particularly in the lungs, to produce the bronchodilation. So this is very, very important. Another terminology is the bolus. So I think mainly for large animal, for oral administration, the solid form of the drug is in bolus form, because bolus is a large pill. You can say large pill or larger in size. If you go through the shape, usually the bolus is cylindrical like mass and solid, or maybe the rounded pharmaceutical preparation, and usually or primarily for oral administration, and the drug should be swallowed. So if you want to define the bolus are the medicinal preparation, particularly the large in size, cylindrical in shape, or sometimes rounded in shape, and used for oral administration by swallowing is called bolus. So this is for the very important term for veterinary preparation for large animal and oral preparation in solid form. This is usually bolus is in the solid form. This is important. Now we have to go through the capsule. I think every person has to go through this capsule and has seen. So capsule are usually the two sheet that is made up of gelatin that is get melted in the GI tract. So capsule are two sheet or tube in which the drug are kept, usually in globule or powder form, and used for oral administration as a single dose. And why this tube has to be given to administer the drug in powder or globule form? Because the drug is usually irritant and nauseant or emetic in nature. So capsule are the two tube inside the tube are made up of gelatin, inside which the drug that are kept are usually nauseant or irritating in nature, and the preparation is for oral administration are called capsule. So I think we all are knowing about various capsules that here I am not going to mention the example, even though you want amoxicillin capsule. Now we have to go through the cream. Cream is quite similar to the ointment or other pasty or semi-solid preparation, but cream are usually semi-solid in nature first and less greasy. Why cream is less greasy? Because cream is actually the emulsion form. So what is emulsion? When we are going to mix two immiscible substance like oil and water together is called emulsion, and therefore the nature of the drug is semi-solid in nature, and it is applied over the skin as a topical application by gentle rubbing. So cream are semi-solid medicinal emulsion form of the drug in which oil and water are mixed together, and the preparation has to be applied over the skin as a topical application by gentle rubbing is called cream. Now we have to go through the decoction. Decoction is nothing. If you want to take out the extract by boiling it, and the concentrated form of the solution obtained it called decoction, and the substance or the active principle are usually in crude form is called decoction. So decoction are the crude drug in which the active constituent are in concentrated form is obtained after the boiling in water is called decoction. Now next is the drop. I think most of the people we have seen the drop. Nasal drop, ear drop, conjunctival drop. So these drops are usually sterile in nature, liquid in nature, in solution form of the drug, and that has to be instilled by using dropper either in the ear and the nasal cavity or the conjunctiva by using dropper, that is called the drops. So this is very interesting to relieve from the eye problem or the nasal as we are using as a decongestant. Now we have to go through the dusting powder or dusting powder, because usually if you go through the powder, that is the consistency of the powder, this is a very minute powdery form, and powder are usually two types that we are calling the bulk powder, another is the divided powder. Bulk powder is used for both oral as well as the external use, and divided powder is used mainly for the oral use. So dusting powder are the example coming under the bulk powder. That means कि bulk powder may be used for oral or external use, but this is free flowing, very fine, and may or may not be external use. And this is in not a single dose, this is multiple dose. The example of the dusting powder is, the best example is neosporin dusting powder that we are using to cure from the infection like wound. Now we have to go through the another dosage form is electuary. What is electuary? So electuary is mainly a terminology used for the, or dosage form is used for the veterinary practices or in the veterinary medicine, in which the drug are smeared over the tongue or the lips or the plates are called electuary. So electuary are the medicinal preparation in paste form and contain the vehicle that mixed with the vehicle like sugar, like treacle, like honey. So, and it has to be smeared over the tongue, plate and the lips. So because of the vehicle, the animal is not going to remove throw it from the mouth. So that is why the vehicle like sugar, like treacle, like honey has to be used to be easily make it to be easily administrable for. So this is about the electuary. Now we have to go through the another dosage from elixir. So what is elixir? Is actually this is elixir is used to mask the disagreeable odor, or you can say not acceptable odor or not acceptable taste. So elixir are the solution usually of aromatic compound, so aromatic sweetened solution like that contain the alcohol and used as a vehicle to mask the unwanted odor and taste of the drug is called elixir. The example is simple elixir. Now we have to go through the emulsion. We all earlier go through this dosage form emulsion. Emulsion is the nothing. This is the mixture of two liquid that is both are immiscible. So two immiscible liquid are mixed together is called emulsion, and in which we are going to use a substance which make it to be mixed together, that is called emulsifying agent. So this is the example castor oil emulsion. Now we have to go through the enema. And this is very important. Why the enema terminology or dosage form is important, enema or enemata? Because this is particularly used for relieving from the constipation, for the cough, also in veterinary. Also, if you want to go through the sonography, for that you have to remove the content, digestive food present in the rectum region. So this enema are liquid medicinal preparation, usually soapy in nature, and that liquid should be administered through rectal route, through anal route, and which is used to remove the content present in the rectum, and that is usually soapy in nature. So soapy water enema are used to relieve the patient from the constipation, and the medicinal preparation in liquid form should be administered through rectal route to remove the content present in the lower end of the digestive tract. So this is about the enema or enemata. Now we have to go through the extract. This is quite similar to the decoction, because in that you can say that is also done the extraction type of thing. But in this case, this may be the liquid, this may be the semi-solid, and this may be the solid, concentrated solid of the active constituent. And that is particularly when we are isolating it from the animal and vegetable source, is called belladonna extract. And in that case, in case of the decoction, we used water, hot water, by boiling water. But here there is we are not using any temperature first, and also we are using the suitable solvent in place of temperature. So here we are not usually going to apply any temperature, and in place of water we are going to use the suitable solvent for extracting out. So this is called the extract. Now we have to gargle. So gargle and mouth wash both are quite similar terminology, and that the gargles are the dosage form used for the gargling. So rather you can say gargle is a process. So gargle in which we are taking the particularly the aqueous solution which contain the drug, and that is meant for the gargling to check from the infection of the throat or mouth, that we are going to call it the gargle. So the example is hypertonic saline gargle. Now we have to go through the gel. Gel and jelly, these two terms are also quite similar. Gel are aqueous colloidal substance, particularly if you go through the aluminum hydroxide gel as an antacid. So this is the gel is in form of the colloidal substance of hydrated form of insoluble medicaments or drug is called gel. Whereas in case of jelly, this is usually jelly are transparent in nature. This is very important. Whereas the gel are not like that. So transparent in nature, also you can say translucent in nature, and non-greasy. Like cream, non-greasy. In cream you will find this is the emulsion product. Cream is the water and oil is there. And the jelly is also the semi-solid in nature, and that is used for the external use. And no doubt this is quite similar to the cream, or you can say the gel. Consistency is quite similar, but in case of gel, GEL, you will find this is the colloidal substance, whereas in case of the cream you will find that this is the cream is the mixture of two immiscible liquid, particularly oil and water, is called emulsion, two immiscible liquid. So that is the emulsion. And we are talking about the this cream. that is the semi-solid in nature, in which we are going to have the emulsion of two substances like water and oil, that is meant for the application over the skin, is called cream. So cream, gel and jelly are quite similar. And ointment is also quite similar, but ointment is also for the local application, but ointment have mainly oily vehicle, so that is more greasy you will find in case of ointment, that we are going to discuss later on. Dosage form. Now we have to go through the granules. So granules are nothing, this is, you can say, a small fine particle of powder is in the form of a small mass, particularly in a spherical shape, is called granules, in which the drug has to be mixed. So granules are small globular particle, or you can say the aggregation of powder, fine powder in mass form, particularly a spherical shape, is called granules. Now we have to go through the implant. So implant, and one more term that with match with the implant is implant, and the another terminology that is also quite similar to that one is that we have to discuss when that dosage form will come, we have to discuss there. So implant, that is from the P letter. So leave it. So now we are going through the word implant. So this is simply plantation of the drug in solid disc or solid disc form or cylindrical form by doing some minor surgery to put in the tissue of the body to the patient, so that the drug should be continuously released and absorbed for longer time interval, is called implant. So implant is nothing, this is simply the planting of the drug, which is solid in nature and shape may be disc or cylindrical, and it should be placed in the tissue by doing the minor surgery within the body of the patient, and this is because the drug has to be absorbed continuously from the by the patient for longer time interval, is called implant. And the example is stilbestrol, is used as a synthetic estrogen to treat the prostate and the breast cancer. This is very important way of keeping the drug within the body of the patient, and that will work for longer time interval, is called implant. Now here I am going to suggest you have to read every terminology concerned to the dosage form, and you may find the most of the terminology you are aware about that. So now we have to go through the inhalation. Inhalation is also the meaning is very simple. When we are taking anything inside the lungs by taking air inside, is called inhalation. So inhalation through the lungs, or through the lungs up to the through the respiratory passages up to the lungs, is called inhalation. So inhalation generally we are going to perform when we are having the dry cough. When we are having dry cough, the drug has to be reached in the respiratory passage up to the lungs, and the drug should be in the volatile way. So when the compound become volatile, become converted into vapor, it will reach up to the lungs. So this is called inhalation. So inhalation is liquid preparation that contain the volatile substance. Important is the volatile substance. The drug should be volatile, and if that substance is volatile, it will be easily come through the respiratory passage up to the lungs, and it relieve from the congestion as well as from the inflammation of respiratory tract. And if the drug is somewhat non-volatile or less volatile, may make it in gaseous form by keeping in the hot water, so that the drug has to be converted into vapor form, and that has to be used for inhalation, is called inhalation. The example is menthol inhalation. Tincture benzoin compound, that compound is to be instilled or to be poured in hot water, and this hot water get converted into the vapor form containing the tincture benzoin, and that has to be inhaled by the patient suffering from the respiratory problem, particularly if the dry cough is there, so it will loosen the cough. So this is used as a drug through the respiratory passage route, and that is called inhalation. Now we have to go through the injection. This is very, very important terminology. So injection is nothing, the drug that are particularly in solution form, or you can say suspension form of the drug, that are used for the therapy of other than enteral administration, called parenteral administration, is called injection. So now we have to go through the insufflation. Insufflation, the literal meaning of insufflation is to blow into. So the definition of this dosage form is, this is the preparation of the dusting powder to be blown, or the act of blowing gases or powder into body cavity by using an instrument, insufflator, in the region like nose and throat or body cavity or ear, is called insufflation. So this is about the insufflation. Now we have to go through the word irrigation or douche. So irrigation is not nothing, this is only simply irrigating the area, particularly the body cavity. So this irrigating the area by using solution that is used for rinsing purposes of the infection concerned to the bladder, female genitalia, vagina, and this irrigation or douche are the drug in solution form used for rinsing the body cavity to treat the infection of the bladder, the vagina, and for that using the soft rubber or plastic tube to carry out the drug to that particular organ. The example is potassium permanganate solution, and the strength may vary depending on the situation of the infection. Now that we already discussed about the jelly. The jelly is the transparent, that we are not going to discuss. Now we have to go through the more terminology of the dosage form are linctus. So linctus is liquid medicine but thicky in nature, and this is viscous, syrupy, and this is very, very important, is used for the oral preparation. So if you want to define this linctus in simple one word, this is a liquid oral preparation possessing soothing effect that we call demulcent. Soothing effect means reducing the inflammation over the mucosa of the throat, is called linctus, and that has to be prescribed in case of coughing, particularly to relieve it from the irritation. The example is codeine linctus. So linctus is the liquid medicinal preparation for the oral oral administration, oral preparation, particularly to relieve from the inflammation, that is called demulcent action, and to relieve from the inflammation of throat, to relieve from the cough, is called linctus. Now we have to go to the liniment. Liniment is the liquid preparation. This is very important, and it is applied over the skin by rubbing, is called liniment. So liniment is a medicinal preparation, or are the medicinal preparation of the drug, and the drug should be either in oil, or you can say alcohol, or you can say the soap, or all in all, and that is only applied externally over the skin by rubbing, and therefore it is used as a counter irritant. Anodyne. Anodyne is the drug that relieves the pain, is called anodyne. Now we have to go through the other dosage form. Liquor. Liquor is the term, the dosage form of the terminology concerned to the dosage form. Sometimes we are using this term for the solution. So liquor is liquid preparation and non-volatile preparation of non-volatile substance in water or alcohol or oil. So in water, alcohol, oils, and other solvent. Example is calcium hydroxide. So this is very important. So here is the calcium hydroxide is CaOH2. So here you have to change it, CaOH2. Now we have to go through the other dosage form, is the lotion. So lotion is also the liquid preparation like liniment, but in case of lotion, that is usually used without friction, whereas the liniment is used with friction. This is the difference between lotion and liniment, and this is somewhat thicky, smooth, but liquid medicinal preparation in water as a base and meant for external application, whereas liniment is the preparation in oil, alcohol, soap, and applied by rubbing, means with friction, whereas lotion without friction. So this is very important. This lotions is also oral preparation, but for internal use. So this oral lotions or troche is the disc-shaped medicinal preparation, and size is small. So solid disc-shaped small medicinal preparation that contain sweety thing, that sugar and gum, and used particularly to dissolve in saliva in mouth. That example is licorice lotion, and this is used sometime for the cough relief. So lotions and troche are in the disc-shaped medicinal preparation, small in size and consisting the sweety thing like sugar and gum, and used to keep in mouth, and the drug has to be melted in the saliva, is called lotions and troche. Now we have to go through other dosage form. Mixture. This is liquid preparation. So this is another liquid preparation in which various medicinal preparation are mixed together, and usually the mixture should be either in dissolved form or the suspended form in oil. For oral administration is called mixture. So this mixture is for the oral administration. Lotions is also for the oral administration, but this is solid, this is the liquid. Mouthwash, that we already discussed rather with the gargle. So this is similar to the gargle. This is also used for oral hygiene or oral infection, to clean, to deodorize. Deodorize means the agent that remove the odor or smell, bad smell, is called deodorize. So it cleans the mouth, that is the buccal cavity, and used to treat the infection. That is quite similar to the gargle. So now we have to go through the ointment that we already tell about this terminology along with gel, jelly, cream. So ointment is somewhat more greasy in nature, and that is also for the local application by rubbing, but this is semi-solid in nature, more greasy in nature, more oily in nature, because this ointment drug is to be prepared in either oil or fatty acid or paraffin basis, and for the applied for the local application over the skin, and the example is iodine ointment. So this is about the ointment. Now we have to go through other more terminology, paste. So this is also the semi-solid medicinal preparation, that is also for the external application, but it contain high proportion of finely powder finely powder medicament, and the example is BIP, bismuth subnitrate, iodoform, paraffin paste, zinc paste. So this is very, very important. Now pellet, yes, pellet is also the preparation or dosage form similar to the implant. This pellet is also implanting, it is in pill shape, and it is also sterile, and it should be implanted in subcutaneous tissue, there in the tissue, but this is under the subcutaneous tissue by incision. Example is testosterone pellet. But in case of implantation, there we use to keep the drug in tissue by positioning, going through the minor surgery, that we already go through that terminology, implantation. Now is the pessary. So pessary is the similar to the one more term that we are discussed with the insertion of the drug to insert in the vagina, that is the irrigation. Irrigation is the only washing of the body cavity, like the female genitalia and the bladder, to remove the infection. But here the liquid is in the solution form and liquid in nature, and it used to rinsing the body cavity. Whereas in case of the pessary, it is the solid medicinal preparation that is also used to remove the infection of the vagina by inserting it there. It may be the remove the infection, or for other purposes we are using that drug, but it is in solid form, and it is melt at the temperature of the female genitalia and exert local action. So this is very, very important, and this is quite similar to the terminology of the irrigation. And one more term is quite similar to that one is the suppository. In suppository, this is also solid preparation, particularly in a wide or conical shape, and that is not only inserted in the female genitalia vagina, but it also going to keep in the rectum, it is also going to keep in the urethra. So as per the its utility, suppository is also solid form, whereas that we already pessary is also solid form, but that is particularly for female genitalia vaginal one. So that is called that is the pessary, whereas the suppository is the solid preparation, medicinal preparation dosage form, that is the conical or wide in shape, that should be inserted in the rectum, maybe the vaginal cavity, maybe the urethral cavity, and the name is as follow as per their use, and that is melt at the temperature of that particular organ. And in case of pessary, that have the local effect mainly, whereas suppository have both local as well as meager amount of the systemic effect, is called suppository. So this is important one. Now we have to go through the pills. Pills is like a small ball of medicine that is the for oral administration, a spherical, wide in shape, and also sugar coated, and this is used for swallowing. We are not going to be chewed it. So this is called pills. Now we have to go through some more terminology. Poultice. This is very important preparation, medicinal preparation, and the poultice is usually used for removing the inflammation. And this poultice is how we are, which type of this medicinal preparation, in which the poultice we are going to use this medicinal preparation to keep in very thin cotton cloth or linen cloth, and that we have to keep over the affected part to relieve from the inflammation. So it is soft semi-solid preparation applied as a hot as well as the cold, and this is has to be applied locally over the particularly over the skin, and heat and moisture as a fomentation to reduce the inflammation is called poultice. Now we have to go through that is put over the skin to relieve the pain and swelling is called poultice. Now we have to go through the more terminology. We go through the plaster. We have, this is very interesting. Plaster is usually that the powder is containing, we are going to mix with some liquid thing, particularly water, to make it in the pasty form, and when we are going to apply over through the linen or using more accessories with this, we are going to use as a protection. Particularly we are going to use this in case of fracture for mechanical support. So this pasty preparation of drug which is sprayed over the piece of cotton or you can say linen, that is meant for external application on the skin, and that melts slightly on that skin temperature and used as a adhesive to fulfill the protection and mechanical support is called plaster. So this is very important. Now we have to go through the more terminology. Powder, that we already discussed. This is the very fine particles in dry form, and it may be divided or it may be the bulk form. So bulk one is used for both oral and internal use, internal and external use, whereas the divided powder is mainly used for the oral administration, and that is the single dose. So now we have to go through the more dosage from sera. Sera is the antibodies serum that is used for a particular disease. Now we have to go through the solution. So earlier we already discussed solution and the solution, and another one is the liquor. It's quite sometimes using synonymous with the liquor. So solution is the liquid preparation and usually non-volatile, contain the non-volatile drug, and that is used synonymously with the liquor, and that may be used particularly for the external use over the skin is called solution. We may use for body cavity, but now we have to go through the spray. Spray is also very common terminology, that we are spraying the drug, and the drug is in either in aqueous solution, alcoholic solution, or glycerin containing vehicle, and which is applied over the mucosa of particularly throat, nose, or other body part using the nebulizer or atomizer. These two are the instrument that are the device that are to throw the liquid into the throat or nose or other body part, and that's the atropine spray is the example, corticosteroid nasal spray is the example, suppository we already discussed. Syrup is also like you can say the solution, but this is the liquid preparation and thick in nature and used as a vehicle, because the liquid in nature and mainly it is sweety in nature. So because of sweetness in nature, this is syrup, and that used as a vehicle and used for the preparation of the drug. Now we have to go through the tablet. I think you all have to go through this word or dosage form, the tablet. This is the solid form of the drug, usually in the small inside, disc in shape, and form it is a powder is get compressed and molded in such a form to form the small disc shape and meant for the oral administration is called tablet. And the last one is the tincture. Tincture is this is the solution, but alcoholic or hydroalcoholic solution. So tincture is the alcoholic or hydro. Tincture is itself meaning the alcohol. So alcoholic or hydroalcoholic solution, that the active principle of the vegetable or animal origin is called the tincture. So this is about the all the dosage form. Almost all the dosage form you go through that. So these are the photograph that you have to. So this is the tincture, like this syrup is in this form, this is eye drop in this form, this ointment is like in this form, then the liniment is like this one, then the tablet is like this one. So these are the things. This suppository that you have seen, this suppository in this shape. So the ampoule for the injection in this shape. So this injectable instrument in this shape. So this is the patches. Now we have to go through the solution. So this is the solution. This is the lugens. This is this is the aerosol that we are inserting the drug in the nose region. So this is the capsule that we already gone through this. This is the capsule. So this is the pills. So this is the pills in which actually that one, the drug in semi-solid in nature. So this is all about the different dosage form of the drug. In next class we are going to discuss next thing. That's all.